Just want to say, first of all, thank you for joining us here this morning. I'm joined by registered nurse Stephanie Fair and, of course, my colleague Vicky Mowat. And we're here today because healthcare in our province is at a breaking point. In a minute, I'm going to play you part of a recording between Air Canada Flight 1937 and the air traffic controllers working on the night of October 2nd. Shortly after 10 p.m., the pilots of that flight declared an emergency using the code PAN-PAN and talking about an issue with the plane's wing flap. The tower confirms the emergency, and the pilots are asked to confirm how many people are on that flight. In the recording, you'll hear the pilot of the aircraft respond, 122 total souls aboard. The plane, thankfully, landed safely. Emergency vehicles had been called to the Saskatoon International Airport and were at the ready. Now, we learned about this situation from frontline healthcare workers who came forward to us with concerns. We then confirmed the emergency by listening to the recordings that you'll hear shortly. Now, let's remember, October 2nd was the night that the Royal University Hospital emergency room was at 350% capacity. Accounts from frontline workers that night and occupational health and safety report have painted what is a truly horrifying picture of what was going on. I'm going to play the audio now.
I'll make it official at this point, and we have a flight control issue. And when it's Rouge 1937, we may as well make it official at this point, and we have a flight control issue. We'll flap. We'll be returning back to traffic to runway 27 here in a few minutes, just to keep you advised. Rouge 1937, I understand you're declaring PAN-PAN. You still need a few minutes. How are the approach? Affirmative, Rouge 1937, we'll let you know when we're ready. Declaring emergency. Affirmative, Rouge 1937. 1937, let me know when you have a few moments. I need a few pieces of information. Go ahead. Yes, how many people are on board? 122 total souls on board, fuel 2.7 tons, no dangerous goods, Rouge 1937. Just confirm that was 122 people, 2,700 fuel, and no dangerous goods. Affirmative. 1937, I've advised radio situation. They're contacting emergency services for you. And plan is just to kind of keep you circling here north of the approach path. Are you ready? Okay, sounds good to us. Just give a few moments here for 1937. 1937, Roger. Emergency services are going to stand by for information on intercept near Saskatoon Airport. If on this clear and do it, please have approach your check on your second.
So that what was occurring in the air overhead that night. On the ground here at the Royal University, it was pure chaos. No oxygen, no stretchers. 90 people crammed into the emergency room. And the nurses working that night responsible for 14 patients each, all of them working in cramped and frankly dangerous conditions. We've also heard from frontline workers that St. Paul's right here was over capacity, and Stephanie, that same night, St. Paul's was over capacity, sitting at about 200% capacity, and Stephanie will tell you that that's been the case here for weeks. And of course, City Hospital's emergency room was closed. All this that night, and then we have a plane declaring an emergency. What would have we done had the worst occurred? That is what healthcare workers have been worrying about and warning us about for years. For years, healthcare workers have been warning Scott Moe and the Sask Party that there is zero excess capacity should there be a mass casualty event. And today, things are even worse than they've ever been, and we're simply at a breaking point. We have people in this province dying for care, people being left on beds in hallways because there is simply no room for them in our overcrowded emergency rooms. Frontline workers who are burning out and leaving the province or leaving the profession altogether. And on October 2nd, by all accounts, the hospitals in Saskatoon were completely full. We had no capacity left to even provide health care at the most basic level. This is the situation healthcare is in Saskatoon. But Scott Moe and the Sask Party still refused to even admit that there's a problem. We simply have to change this. We have to get Saskatchewan out of last place. And I commit to you, we will. We have a plan to fix healthcare, and it has to start with staffing up, hiring the people we need to make sure that our hospitals have the capacity to offer emergency care when it's needed. We're going to invest in our hospitals, $1.1 billion into the system to keep our emergency rooms open and to keep us staffed up. Starting with the City Hospital emergency room, which we're going to open for 24/7 care. We'll get paramedics out of waiting rooms and back on the road by modernizing the Ambulance Act. And while we work to implement those changes, we'll make sure that people know when there are unplanned emergency room closures by launching an online dashboard. This election, there's a clear choice. Saskatchewan deserves better health care and emergency care that's there when you need it. And in a month, less than a month, Saskatchewan people are going to have that choice. This election, you can vote for change. With that, I'm going to turn it over to Stephanie.
Thank you, Carla. 1 second here. So my name is Stephanie Fair, and I'm a registered nurse at the hospital behind us at St. Paul's Emergency, St. Paul's Hospital in Saskatoon. The possibility of a mass casualty event is terrifying. I myself have been involved in many emails and cries up the chain of command shouting that this is a very high risk that we are running when we are in this capacity situation. If there was a mass casualty event called, we would call a code orange in the hospital and people would die. We just don't have capacity. We don't have emergency space. Emergency rooms are the public safeguard. We are the only place you can go if you're having a heart attack or a stroke or a cancer emergency or a trauma like a car accident. Like Carla said, our emergency department at St. Paul's is sitting at 200% capacity every day. This is our new baseline, 200%. That means we don't have space to safely treat you when you have that emergency. This means that despite our best efforts, we cannot provide the care we should be providing for any semblance of safety. This means we are likely to miss you deteriorating because you, with your emergency, are sitting in our waiting room. And we are being stretched too thin. Every bed is full. Our hallways have been made into makeshift rooms, and they're full. Our waiting room is completely full. It is standing room only. The emergency staff try their best. They still leave in tears knowing that they didn't do a good job or a safe job. Let me give you an example. When a patient has chest pain, they need a heart monitor and to be thoroughly assessed and continually monitored by a bedside nurse. We could do that 5 years ago, but now we can't. Most heart attack patients that come through our door today receive nothing like that. We're so over capacity that they will never leave our waiting room and never be attached to a heart monitor. This is nowhere near good enough. We just don't have enough beds, and that's dangerous and deadly. A lot of diseases can't be immediately caught when a patient arrives. It's only through close observation, assessment, and care by that bedside nurse that we can catch deterioration early. That is impossible in a waiting room. The triage nurses are not able to directly observe and check patients enough because of the huge volume of work expected of them. These are system problems, but nurses are the ones having to face the consequences. We are the ones that have to make these ethical decisions. We are the ones that have to look our patients in the eye while the system fails them. We have to pick, when there's dozens of patients in our waiting room, who gets the bed and who doesn't. Do you know how high those stakes are? Do you know the weight of that burden? If we pick wrong, people could die. That's what we carry. But we never reach a maximum. We accept more and sicker patients with no relief in sight. Somebody who's been bear sprayed, a stabbing, a chest pain, abdominal pain, a kid who needs to have their cut stitched, somebody in a diabetic crisis, and now the ambulance is calling and they're 3 minutes out with a cardiac arrest. It never ends. Pretty soon we're going to be forced to treat our patients out on the street in front of emergency. That was the situation when I worked in Haiti. We are close to that here today, in Saskatchewan. We know what good care looks like, and we're not delivering despite our best efforts. We are the ones that have to worry about a patient dying in our waiting room every second of every shift we work. That is why emergency staff are burning out and leaving. We are losing new young nurses, our profession's future, within months. The government doesn't care. They're not listening to us. 2 days ago, my triage staff tried again to claim their right to refuse unsafe work, which is an OH&S right within legislation, and even that was ignored. We've been crying for help for so long and so loudly with our broken hearts, and no one is listening. They don't care. I don't think I can watch any more of my nurses cry, break down, and tell me how much they're worried about their licenses because of the situation they're put in every day. We need you to do something. We need the public to vote and fix this. It's a terrifying situation. We live this every day. We can't keep going like this. We can't let Scott Moe and the Sask Party run our healthcare into the ground anymore. People will continue to die. It's time for a change. Please, please help us. Lives depend on it. Thank you.
Just want to say thank you before we start and take questions to Stephanie for your advocacy, for the care that you still provide to people in impossible situations. Happy to take questions. I'm sorry, I just had a little trouble hearing your question.
Sorry,
No worries.
Earlier this morning, Scott Moe said if elected, he plans to address healthcare issues by expanding on an already working human resource plan. What did you say to that?
If what Scott Moe and the Sask Party were doing, we wouldn't have nurses like Stephanie out here begging for help. If what Scott Moe was already doing, we wouldn't have the longest surgical wait times and people dying on those surgical wait times in this province. If what he was doing was working, we wouldn't have hospitals at over 350% capacity and no capacity to deal with any extra, let alone a mass casualty event on top of that. If what Scott Moe is doing was working, we wouldn't have 1 in 6 people in this province without access to a family doctor or primary care. We wouldn't have women waiting for months with a lump in their breast, wondering if they were going to get treatment, or having to pay out of pocket or drive out of province. You know, it's simply insulting to those who have the lived experience, like Stephanie and so many others across this province on the front line, when they wave that human resources action plan and call it the most ambitious in Canada, when the system is crumbling right around us. It's not working. And again, as I said, and you know, if Scott Moe is so proud of his record, he simply doesn't understand the reality in healthcare in this province right now. It's another reason why it's time for change. There are no magic solutions to this, but you're not going to get better in healthcare. People aren't going to get the care that they need. These nurses and healthcare professionals are not going to get the support and the change that they need if Scott Moe won't even recognize that there's a problem. We've got a plan. It has to start with respecting and retaining the valuable healthcare workers that we have in the system right now. Recently, 500 nurses gathered in Regina to talk about safe staffing. Scott Moe didn't even bother to show up. His healthcare minister, who said he would show up, didn't even have the courtesy to phone and say he wasn't coming. It's just insult to injury. This is why people are looking for change.
I'm just curious, $1.1 billion is quite a lot to dedicate to healthcare, but in terms of specifics, should the NDP form government on day one, what are some specific things that your government would do to address the needs of the general healthcare system?
Yeah. It has to start with stabilizing the existing workforce, our valuable healthcare workers in the province. One of the things that the nurses, for example, have been asking for years has been a nursing task force to address shortages. When we were at that meeting, when we did show up to speak to nurses, I told the nurses that they could expect a phone call from me right away to strike that task force. Some of the solutions, this isn't about sitting around and waiting. They've already been putting the solutions forward. We backed that up with our investment, $1.1 billion, to show we were serious about addressing these needed changes in the system. And as I said to nurses that day, the number one thing that they need to know is that there's someone who believes them, who will work to understand both where the concerns are, but the solutions. And nurses have been coming forth with solutions for years. What they haven't had is a government willing to listen to them. That's day one. Signaling, talking to those frontline healthcare workers on the front lines, telling them to hold on. We're serious about working with you, and we're going to start as fast as we can implementing the solutions that you know are there. That's got to be day one. And as we said, modernizing the Ambulance Act so we don't have paramedics who are backed up on calls waiting in hallways instead of out in the community helping people where they want to be as well. Again, we will attack this issue with the urgency that it's required, but we know it will not be fixed. Waving around plans that aren't working, refusing to acknowledge a problem. We're going to work with healthcare workers, we're going to work with communities to address those solutions, but it has to start on day one with signaling to those healthcare workers, we believe you, we want to work with you, and we're going to implement changes that are going to see your workplaces, our healthcare system, start to return to the place that Stephanie talked about 5 years ago, where she knew she could give good patient care. That's what we need to be doing.
Can I get your thoughts on the David Buckingham apology he put out yesterday?
These are really shocking things for anyone to be saying. I understand there was an apology. I think Scott Moe, as the leader, needs to account for what goes on in his caucus, Mr. Buckingham, and on a number of issues. I will say this: it's not something that I think most people would stand for. We're in the middle of an election. People in Westview will have their opportunity to register what they think about the actions and the apology.
You've probably seen the allegations from the speaker that go wider than what Mr. Buckingham said about limiting immigration to certain countries and that sort of thing. What have you noticed with the government members? Do you notice this sort of, it's implied that there's racism? What have you noticed?
Again, Scott Moe, as a leader of the caucus, really needs to account for those allegations and also set the tone in terms of behavior within a caucus. I know, speaking for my caucus, we have a team of people who are dedicated to ensuring that all people in this province have opportunity, have respect, have healthcare and education, and the things that they need to thrive in this province. That's how we're going to meet the potential that we see in every corner of this province. That's a leadership role, and Scott Moe needs to answer for any concerns about the behavior or the conduct of his own caucus.
Carla, just a year ago, there was a lot of chatter around parental rights, a lot of things happening with the station as well. And members of two LGBTQ plus community say that there has been an increase in the transphobic and homophobic rhetoric since then. How do you first of all respond to that, and why haven't we seen any mention of that?
So an increase in transphobic. I mean, we went through 40 hours of emergency debate on that bill, reminding people in this province, we didn't go back to the legislature to discuss the fact that our healthcare was crumbling. We didn't go back to the legislature to deal with any of the other issues going on in education or healthcare in this province. Scott Moe called us back after a by-election where he lost 20% of the vote to the SUP, who was making this particular issue a campaign issue, called us back for the first time in 25 years to an emergency session. Our team of MLAs did an admirable job of pointing out those very concerns, that Scott Moe was stoking division, that his actions were going to lead to further harms to Saskatchewan people, to vulnerable kids. And unfortunately, that's exactly what's happened. I haven't heard that particular statistic in terms of increased harms on the doorsteps. But I do know, I hear from a lot of people that there are a lot of issues in healthcare, or in education rather, well, in healthcare as well, but a lot of issues in education related to the government's decade of underfunding and cuts to our kids' classroom. People say that is the number one issue facing our classrooms. That's why we've proposed to invest the $2 billion and not play this race to the bottom game of divisive politics, where we make already vulnerable people in our province more vulnerable by legislation and emergency sessions like we saw with Scott Moe and the Sask Party last year.
Bill 137 is a key election issue for at least some people to essentially
Why do I think that is? Because it went after human rights. It went after human rights and then applied the notwithstanding clause 2 times to further take away from people's rights. And I think it's an issue for all people who want their human rights to be respected. It's this kind of ugly, divisive politics, focusing on things like that instead of hospital rooms, emergency rooms at 350% capacity, or people not being able to get health care. It's another one of the reasons why people are saying we need change. Look, people who voted for the Sask Party for years are telling me, you know what, I just want adults in charge making decisions again in this province. I just want to make sure that decisions are being made to actually try to fix things, not try to wedge people one against another. That's what we've proposed. Here in healthcare, in our platform, has been built listening to the people of Saskatchewan and proposing real common sense solutions that ensure we get best services and best value. We have a growing economy in all sectors, and we get back to balance in 4 years. That's what people expect. That's what I'm hearing on the doorstep.
I will give you an opportunity to respond to some suggestions Scott Moore made earlier today. What is the NDP, I'm pretty sure I know the answer, but the NDP, do you have any plans to decriminalize drugs? And what is your policy on safe consumption sites?
Look, we, again, are on track in this province to have a record number of overdose deaths. We have growing crime rates right across this province. Our proposal has been, again, not to lean into, where we can make the most noise in divisive politics and actually start to address the problems so people aren't dying waiting for treatment, people aren't dying on the streets, and also dealing with those who are bringing poison into our communities. And I just had the opportunity to talk with a number of people from the north who were crying out about what these drugs are doing to our communities. It's not an either-or solution. It is about effective policy. It is about taking action, understanding what's in front of us, and working with all options available to us to both get tough on crime, but also dealing with the root causes of crime, mental health and addictions. This government actually made things worse when they made the changes to the SIS program against everyone's advice. They made things worse than when they refused to invest 2 years ago in frontline policing and instead brought in their pet marshal service that has seen us spent over $14 million and doesn't have a single boot on the ground. This is about effective policy making to deliver results for people. We need to return in this province again to having governments that make decisions in the best interests of Saskatchewan people, not in the best interests of politicians. I'm tired of that, and I think Saskatchewan people are tired of that as well.
So just to clarify, you would change back SIS. Would you
Yes.
do you have any plans to decriminalize drugs?
No.
Do you support safe supply or safe consumption sites?
I support effective measures to ensure that people in this province stay alive, to get to treatment, that we are looking at all options available to us right now. And you can see it. We saw it on the way here. We have unsafe consumption sites right across the province. People who are losing their lives on the streets here. I understand the concerns about crime. I understand the concerns of businesses and people who don't feel safe. It's time we had a government that was serious about effective action instead of, these talking points and pitting people against each other.
Does anybody have any questions for Stephanie before we close?
For Stephanie? Oh, for me. I think we're just asking for Stephanie in case she has to get back. If there's anyone who has a question for Stephanie.
I'd like to thank them personally.
Yeah.
I know for a fact that if I had gone into St. Paul's today with the condition that I saw there went 6 years ago, just like you said, I would thank the healthcare system for working way beyond their capacity. And thanking them for my life. And I give back to the community by working in some of the outreach centers on 20th Street. Because that's what I'm tired of seeing is cutbacks and cutbacks instead of 24-hour service. Now we see only open from 8 to 4. And they're healthcare professionals starting to cut back to their hours.
Yeah. No, it's a good point. And first of all, it is important that we thank those hardworking healthcare workers that we have in our province and thank them. But when those who are making decisions are saying things like thank you, but then refusing to listen to them, but refusing to show up, that rings hollow for them. We're saying thank you, but we're also saying we've heard you. We're going to implement the solutions that you've put forward, and we're going to fund it. It's important. Scott Moe will, accuse those who bring up problems as talking them down. We are not talking down healthcare workers in this province. We want to support them. We want to ensure that their working conditions improve, that healthcare improves for Saskatchewan people.
Yeah, thank you, Carla. Just a question.
Yeah.
So you spent time campaigning in the mid-sized cities in Salford, so I'm just wondering how important are those mid-sized cities to the election?
I've never approached this job or the leadership role or this campaign in a way other than this. I want to be the premier for all people in this province. Regardless, if we have that honor after October the 28th, regardless if people voted for us or not, our goal will be to work with all people in this province and deliver better government, better healthcare, better opportunity for every area of this province. We're working hard in every constituency right across this province. I understand that some will be more difficult than others, but there are people in every constituency in this province who feel like they don't have a voice, like their vote hasn't counted. We're out there making sure that people understand that change is possible this election, that we are working hard to deliver that change, and that their voice does matter. We need all Saskatchewan people who understand that we deserve better than this to stand up, to vote in this election, starting on the 22nd, so that we can deliver that change.
A year ago, the province announced its plan for homelessness. What do you think of that plan? What do you think it's addressing the need? I mean, we're starting to hear numbers like 800 homeless on the time count that's happening right now here in Saskatoon. Obviously a problem in China as well, in Salford, and probably elsewhere that I'm not aware of as much. What would you do differently?
It's not working. I think that's the
Really a truth, but you.
We'll be away quickly. One of the things that and we can back up with a lot of statistics, and I know that they exist. I know that the fire service here in Saskatoon has calculated this. There are a number of agencies who calculate this, but the people of Saskatchewan can see when they drive through almost any city, any town in this province, that this is not a problem that's getting better. It's gotten worse. And again, you see a government that takes an already crisis level of mental health and addictions and homelessness and makes frankly stupid decisions like the changes that they made to the SIS program. Changes that everyone from anti-poverty activists to municipalities to frontline officers to landlords told them was a terrible idea, that it was going to increase levels of homelessness, and it's done exactly that. This is a government that often says we'll take no advice from. Well, it's time you had a government that will take advice, that will listen when they're trying to address these very complicated issues. One of the things that we've proposed, we have 3,000 housing units sitting empty in this province right now. 3,000 at a time when we have people on the street without homes. That doesn't make any sense. Not only are they not providing homes for people that desperately need them, they've foregone $200 million in rent and in utilities by leaving those units empty. It doesn't make sense. This is a government that talks about how much they spend. They spend and spend. But Saskatchewan people are getting less, and people can see the results when they look around. It doesn't have to be like this. We need to start addressing these issues in an effective way, and again, a way that improves reality, improves conditions and services, not in a way that benefits a political narrative by a party that seems to want to fight elections but doesn't have a lot of interest in actually delivering the services that people need. I think I'm going to get kicked off the court here.
I have to go back to work. Can I just get you to speak to the press release that was sent out earlier today saying, oh, sorry.
Carla? Okay, so nothing for
Okay,
me.
sorry.
I'll step away.
See you in a couple minutes.
Yeah, okay. Thanks for having me.
Please vote. Please vote for the NDP.
That's what we need. Thanks, guys.
Yeah, then he sent out a press release today just saying how Mo is announcing a glucose monitoring plan, but he stalled on signing the monitoring plan. Can you speak on that?
Sorry, I'm still having trouble hearing you.
No, sorry. The NDP sent out a press release earlier today saying how Mo is announcing, a glucose monitoring plan, but he stalled on signing the monitoring plan.
So I understand that Mr. Mo, the Premier, put out a press release saying on the eve of an election, he's going to have a plan for glucose monitoring. Look, this is something that people need. I hear from seniors. I hear from people all the time that they're choosing, halving their medication or not testing as often as they should because they can't afford the testing. This is a good thing. I think what Premier Mo has to account for, explain to Saskatchewan people, is why he stalled in signing on to the federal pharmacare plan that would have had these supplies, diabetes supplies, as well as contraception covered. Why he waited until the eve of an election to deliver basic health care for people. Again, people are tired of this. This is a government that's been in power for 17 years. And they're doling out trinkets on the eve of an election. People deserve better than that in this province. Again, I'm glad, that it's a good idea to have those supplies covered for people. Will help people. This is something he could have done, should have done earlier. This and so many other issues. Thank you all.